that we have discussed the process of wound healing, let's talk about the factors that may affect wound healing. So if you haven't watched the process of wound healing, you can click the link on the top right corner, or you can check in the video description. There is a link there. Right, so these factors may be classified into local factors and systemic factors. The local factors include the following: infection, the presence of necrotic tissue and foreign body, poor blood supply, venous and lymph stasis, tissue tension, a hematoma, a large defect or poor apposition, a recurrent trauma, X-ray irradiated area, and underlying diseases like osteomyelitis and local malignance. Right, so this is at the site of the wound. Right, so there is another question. It's asked about the principles of a good suturing. So you need three things. You need a good suturing technique, the actual technique. You need low tension, and you need good blood supply. Right, so those three, if they are compromised, those may actually lead to a poor wound healing. They also lead to those surgical site infections. So we covered the surgical site infections. There is also a link to that video in the description box. So if you remember those three, you remember like the most important ones among the local factors. Now, looking at the systemic factors, age, as someone is getting older, there is poor wound healing. There is lifestyle. We're talking about someone with obesity, smoking, alcohol, stress, malnutrition. Here we're talking about zinc, copper, manganese. So these are the trace elements that are important in the process of wound healing. Vitamin deficiency like vitamin C or vitamin A. Someone with anemia has increased chances of poor wound healing. General malignancy, uremia, immunosuppression, right? So immunosuppression, here we're talking about diseases like HIV, we're talking about diabetes, and also someone who is taking steroids and cytotoxic drugs. So these are the factors that may affect wound healing, the local factors and the systemic factors. Thank you so much. In the next video, we are going to look at what could go wrong in terms of wound healing, the aberrations, that is a keloid and a hypertrophic scar. Stay tuned.